Welcome to I Hate James Dobson, a sexy yet informative podcast. It's fine.
That's the best part. Welcome to I Hate James Dobson. It's fine.
It's fine. Welcome to I Hate James Dobson. My name is Jake, an evangelical turned queer sex therapist. And as always, I am joined by the beautiful Brooke. Hi, Brooke.
Hi. I noticed you're introducing me alphabetically lately.
Mm-hmm. With alliterations.
Yeah.
Doing my best.
I like it.
Brooke, how are you? How have you been?
I've been really great since last we spoke, since I saw you 12 minutes ago. And things are good. It's summertime, Jake. We're going to go to the beach soon, you and I.
Yes.
That'll be so fun. We're going to have a big old beach day. But I am going to get a mallard duck swimsuit. I guess that's the same thing. But I'm going to get a mallard swimsuit. I think a one-piece black swimsuit covered in serious-looking ducks is the funniest thing
I love that.
ever.
I really enjoy the contrast of you and that and me in this bright pink Speedo.
I want my beach experience to look like I'm also at the library of a Victorian castle.
Incredible.
Yeah.
Brooke, have you kissed dating goodbye?
Not on purpose.
Did dating kiss you goodbye?
I mean, I think I kind of have, actually. I haven't taken it very seriously in a long time.
Brooke, what have we learned about purity culture?
We've learned a lot, Jake.
Mm-hmm.
We learned, we learned that it's aimed at kids.
Mm-hmm.
It's about building loyalty. It's about keeping them under the umbrella.
Mm-hmm.
And that it is, contributes to rape culture and absence of self, we talked about.
Yeah.
And purity balls.
Yes, we did. I was so happy. It's one of my favorite memories of my life, being able to teach you about purity balls and see every progressive second just your heart breaking a little bit more. What we have learned applies to our lives today. Dobson has a lot to say in his books. Now we know that Dobson's words aren't for anyone, but now that our job is almost done, let's take a look. It's a VeggieTales reference, don't worry.
Oh. That's a, I'm too old. But what, VeggieTales was religious, weren't they?
We might do an episode on VeggieTales as like a one-off.
Oh, yeah?
It kind of slaps.
Okay.
It's kind of great still.
Okay.
So
I mean, I'm going to need to understand more about how those carrots found God, but...
They're not allowed to say that God loves them because the main creator's mom doesn't believe that vegetables have a personal relationship with Jesus.
Or a soul.
So it's always God loves you very much, not God loves us very much.
Oh, poor veggies.
So canonically, Larry the Cucumber's going to hell.
Oh, no. Oh, God. Okay.
Today is episode 4, our final episode in our series on purity culture. We've read books by influential people in the movement, we've looked at the history, we've seen how it functions, and the very real and very awful consequences of the culture. Purity culture has contributed to a fucked up understanding of sex, sexuality, and human relationships more generally, so we need to build a new idea of what these things can mean. In this episode, I and Brooke will try to talk about James Dobson as little as possible.
Yay.
It is so important to call out all of his horrible beliefs and deconstruct them. This helps give a voice to pain that's been suppressed, as well as help us fight back against it. But deconstruction can't be the full story. We have to build something new. And that's what this episode is. A better way forward.
A new hope.
I feel particularly qualified to talk about this. My entire academic and professional career has been centered around sex and relationships. Not to brag a little too much, but I have a minor in LGBT studies. I've taken many classes about the mental and physical aspects of sex and gender. I've been an adjunct professor at a graduate university teaching a class about sexuality and therapy. I train other therapists in working with sexual minorities in a relational context. I'm a motherfucking licensed marriage and family therapist, a queer sex therapist. I've had to go on a journey both of deconstruction and reconstruction, and I'm here to share with the class what I've learned.
This is exciting.
Professor Jake is here.
Yay! This is fun.
So, Brooke, what's sex?
Well, That's a question I've asked myself in several iterations over my life. Well, Jake, sex is intimate physical connection between people.
Okay.
I was gonna say two people. I don't know if that's true either. I mean, I don't know how to say it. I would say most people think that it is P and V. Penetration, intercourse is sex.
Vaginal penetration by a penis.
Yes.
Yeah.
Or, for a long time, I would say I was surrounded by people who thought that, like two men with penetration was sex, right? Mm-hmm. But I don't think that anymore. I think it is more than like kissing or making out, but it is not necessarily penetration.
It's a weird question to ask.
Yeah,
and it's one that I like to ask in a lot of my classes and trainings as well, because like it's not just penis and vagina sex.
Right.
Oral sex and anal sex, I would say, probably count, unless you're Bill Clinton, apparently. What about hand jobs? Dry humping? Mutual masturbation? Right? So my definition, sex is whatever gets you off. And this definition is important because it is broad. Sex doesn't mean any one single thing. It means something different to each person, and typically, many things to one person. Having an expansive and fluid idea of sex, one that centers around someone's personal experience, is the central piece and our new foundation on which we build a better way forward. And it stands in opposition to purity culture's hyper-focus on PIV sex. The other centerpiece is a sex-positive perspective, rather than one soaked in shame that purity culture presents. There's a lot of misunderstandings, so Brooke, what is your understanding of what sex positivity means?
God, we could have maybe done this one first. I didn't know I had to go to school.
You're not drinking.
You're not drinking. Okay, say it again. My understanding of sex positivity.
Yes.
Okay. Sort of like the opposite of purity culture in a way, right? This idea that like sex is healthy, consensual sex is positive, good. I just defined it with its own word, but that it is like something to be celebrated, taught.
That's fair. To me, sex positivity doesn't mean go have sex with everyone all the time. And if you're not having sex or you're not kinky or whatever, that you're bad. No, it means viewing sex and all of its messiness and complexity as a natural and often healthy part of the human experience.
That was better.
Thank you. I worked really hard at the definition.
That was really good.
So we're going to talk more about both of these, but to me, the starting point with this understanding of things and also with the work that I do with a lot of my clients is that you're fine. Your ideas, your sexuality is fine, your sex drive is fine, your body is fine. Like all of these things, if we just start from the assumption that you're probably okay, that's actually pretty radical and stands in direct opposition to evangelicalism itself, which says you are fundamentally broken.
Yeah.
When we take this fluid approach, it's all about you and your experiences and with the assumption that it's fine, what we're talking about is the meanings that you attach both to sex and relationships. There's nothing inherently wrong or maladaptive about hookups and anonymous sex. But if that's not the sex you want to have, then don't, right? Nothing wrong here means it's not a sign of dysfunction. You would get to have your own morals. Maybe any one of these things isn't true. Maybe your body might have chronic pain. You might be in a bad relationship. You might have problems with your sexuality, whether it be function or problematic desires, or you've experienced trauma or whatever it is. Those are very real and worth discussing. But let's just assume, all things being equal for a moment, that you're okay. Because shame is not helpful in this conversation. Importantly, also, to build a sex-positive perspective, it's important to articulate your sexual values. Because being able to say, I want, as opposed to I don't want, is really important in this. There are so many people that I see who can say what they don't want in a relationship or in sexuality, but to be able to say, I want you to XYZ, I want you to give me a blowjob, I want you to hold my hand right now. To ask explicitly for your wants can actually be really hard for a lot of people. So it's really important to say, here are the things that I do want in a relationship. Some examples of sexual values that I teach in my classes: consensual, non-exploitative, protection from STIs, HIV, and unintended pregnancy, honest, pleasure-focused. But you get to have your own values with these. And you can pull from this list, it can have your own wording, it can be something in direct opposition to that if that's what you want. For me, also important to talk about relational values. So my relational values: honesty, dignity, boundaries. I want intimacy but not enmeshment. humanity over tension. We can disagree and argue, but I will always listen to your side. I always try to understand where you're coming from, even if I disagree. Financial security. I'm financially very anxious. I need people in my life who have their own levels of financial stability and security to have healthy relationships. Shared knowledge. Let's have shared experiences, build a shared language. Priority. Special things get to be treated as special. Work in your relationships, romantic or otherwise. What do you value? What do you want?
I value like trust. I value humor. Probably almost highest, right? I value ability to help each other. And I also value autonomy. Right? I am really, really, well, in my romantic relationships especially, I think it's important to me that the person I'm with has their own sort of like rich life.
Yeah, absolutely.
Yeah.
I do a values exercise with pretty much all of my clients because, especially deconstructing from evangelicalism, in that world, people think for you. There are rules to follow. They tell you what to do, what boxes to fit in. And if you don't, you try to make yourself fit into that box. Because we're focusing on your own individual meaning, you have to be able to articulate what these things mean for you. It's a very personal experience. And to list out your values, for some people, is actually kind of hard. I have an activity where I have a bunch of like words on cards that I give to people so they don't have to come up with words themselves, because just coming up with something out of the blue can be a little bit intimidating. But to the readers of this blog, I encourage you, take a moment. Think about what your values in relationships and sexuality actually are in positive terms. What do you want?
Also, there's an online version of the values card sort.
One of the values, the sexual values, the last one that I said, pleasure focused. And this is, I want to take a moment specifically on this one, because there's so much fear mongering about in evangelical worlds about like the idea of like, if it feels good, do it. This is their like thing about like the sexual revolution was bad because it's a feel good, do it. And free love is bad or whatever. And I see many, many clients who struggle just to have sex because it's fun. Sex feels good. It's okay to want it just because of that. The clitoris is the sexual organ whose entire purpose is pleasure. It is okay to enjoy the physical sensations of having sex, to do it just because you want to. Hedonism isn't inherently bad.
Right.
The main thing about my deconstruction from evangelicalism is having nuance and bringing in a lot more nuance than was given to me about these things. Hedonism can be bad. It can lead you down all sorts of terrible places. But like we said in the last episode, I like to ride my bike down the lakefront trail just because it's a really nice thing to do. That's hedonism. Just because it's fun, just because I want to, just because I like it. That gets to be okay. When you spend so much time focused on what sex shouldn't be, you weaken your ability to say, yes, I do want this. So sex positivity to me means being able to enthusiastically say, I want this, which means knowing your wants and needs, having confidence in being able to communicate them, and having the skills to do so, being able to enjoy it when those needs are met, which is something that's actually really hard for a lot of people to do as well, to actually just accept pleasure and joy and connection. And also, being able to say no without fear of lashing out. So now that we've built a basic foundation, let's see how the world looks now. Sex is fluid and personal and natural and often a healthy part of the human experience. This broad definition makes space for so many people. Queer people now get to be affirmed in this model, including asexual people, right? If you don't experience sexual desire or it's a lot more limited than most other people, it's fine.
Right.
You're probably fine. If you have raunchous, kinky sex all the time, but you're doing it in ways that feel aligned with your values and you're taking care of yourself and other people, great. And everything in between gets to be valued. We're seeing how this new sex-positive perspective also directly impacts non-sexual relationships. When we can affirm queer sexualities, we can more easily affirm and celebrate queer relationships, even and especially quote-unquote non-traditional ones. It opens up space for polyamory without denigrating those who find value in monogamy. Both can work depending what they mean for you. If sex with my partner is something I consider to be sacred and exclusive to us, amazing. That sounds rad. If sex is an important part of the relationship, but I don't really see it as sacred, and thus I'm fine with other people being involved sexually, fabulous. My starting point in therapy is you're probably fine, especially when it's grounded in your sexual values.
I wish you were my therapist.
No, you don't. Thank you. Similarly, your relationships, if they're working for you, they're also probably fine. Again, as long as they're rooted in your relational values. If you're a gay man, but you're married to a woman, but your relationship lets you be yourself and validate the love that you have for each other, neat. If your parents hold political beliefs that feel antithetical, even potentially harmful to you, but you found a way to keep them in your life because that's an important relationship, fabulous. I'm glad to hear it. If you have a lifelong partner that's deeply intimate but not sexual, that sounds magical. All of a sudden, the breadth of the human experiences get to be celebrated in this model. Now, there is sexual dysfunction. There are problems in sex and relationships. So just because we're starting from the starting point, everything's fine, sometimes things aren't. So let's talk about sexual dysfunction, relational dysfunction. Brooke, what do you see? We talk, like, sex comes up in therapy, even if that's not the presenting issue, because it's just an important part of life. What do you see as, like, common sexual problems?
Well, first I want to say, I don't know about when you were in school, but when I was in school, human sexuality was an elective.
Mm-hmm.
And I took it because, obviously, but it was not a required class. And I am baffled often about that because it's one of the things I talk most about with my clients.
Mm-hmm.
Or they bring in, right?
Yeah.
And I think that some of the things that I see are, a big one is desire discrepancy.
Which is
when one partner has a higher sex drive than the other.
Mm-hmm.
Or one partner isn't as interested in having sex with that person as the other one is, or doesn't want it as often, or wants a different type of sex, right? I see people talking about wanting to have sex with different partners, multiple partners, or maintain their relationship, but become open.
Mm-hmm.
I see people with physical things going on. There's like erectile dysfunction, vaginismus, those kinds of things.
Mm-hmm.
And obviously, I think another one I see is just like kind of questions about sexual orientation.
Yeah, absolutely.
Mm-hmm.
So just even in that list, we've talked about biological things, we're talking about psychological things, relational things, interpersonal things, individual things. Like, one of the reasons that I love being a sex therapist is because it kind of touches on everything.
And I want to make it clear to our readers of this blog that I'm not a sex therapist. I'm primarily a grief therapist.
Yeah.
And I still am talking about all of those things, right?
It is a little bit, this is something that I think about a lot, that like you were saying, human sexuality often isn't a requirement for therapists. Depending on your license, each license in school does a little bit differently, but definitely not to the degree that I think it should be.
Right.
To me, and maybe it's, my own biases, I am a sex therapist, but like, even when people don't come in wanting to talk about sex, we end up talking about it in some way because it's just part of their life.
Right.
Whether it be identity, relationships, whatever.
And I will also say that even when I did take a human sexuality class, it was not extremely LGBT focused, and it certainly wasn't, we weren't talking about non-monogamy or multiple partners or anything like that. It was pretty by the book.
When you only have, 2 credit hours or whatever to talk about human sexuality, some things are inevitably going to be left out. Not everything is diagnosable, and the DSM, which is the Handbook for All Recognized Mental Disorders in the United States, is flawed. However, the DSM has the following sexual disorders listed. They are desire disorders. Interestingly, they're only lack of desire disorder, so male hypoactive sexual disorder and female sexual interest/arousal disorder. Both of these are a marked lack of interest in sex. Importantly, that causes distress, so this is different from asexuality. Typically, there's like a notable onset of this, like I used to be really into sex, I used to have the sex drive, and I've noticed it decreasing. And to be diagnosed with this has to last for like 6 months. Importantly, it's also common as you get older, and your libido may tend to wane, or with time, or whatever. So desire disorders, that's one group.
Or medications, or all kinds of things.
Absolutely.
Mm-hmm.
Arousal disorders. And the only one here that's listed is erectile disorder, which is the inability to obtain or maintain an erection 75% or more of the time. 2% of men under 50 reported, although I suspect that number is a lot higher because a lot of people just have a lot of shame wrapped around it. Almost 50% of men over 60 report it. The United States military spends more on Viagra prescriptions than gender-affirming care.
Well, that's so annoying.
Yep. But God, we can't have the trans military. It's going to be too expensive. Also, you can get erectile dysfunction fixed by means other than Viagra or pill medication.
Right.
Most erectile dysfunction is psychological. It can be physiological. Blood doesn't stay in the penis for whatever reason, but often it's more about shame, performance anxiety, like self-consciousness. The main way to tell the difference is if you get morning wood, then it's probably psychological.
Oh.
Other treatments for erectile disorder include mindfulness, letting go of that shame, being able to, again, say, I do want this, I'm able to take in the pleasure. Also decentering the penis and vagina and orgasm in sexuality. If sex is whatever gets you off, it can be just a really good session of making out. It can be foreplay. It can be like having oral sex while you have a flaccid penis. Like there's any number of things. When you have a good time and you're focused less on the specific functioning of your body actually functions better.
Yeah, and you can also just like return to different levels of intimacy, like sensate focus, right? Where it's like you can, instead of just like trying to have sex and then worrying about if you're able to or not, it's like go back to like cuddling, go back to touching, right? Like these, like go back a few steps and rebuild intimacy a little bit.
Sensate focus is like the go-to intervention for people, specifically couples who come in with sexual dysfunction. And it is, they talk about focusing on sensual intercourse as opposed to sexual intercourse.
Right.
So it literally is a week by week thing. I've done this with a number of people to really good effect, where week 1, you take turns touching each other's bodies. There's no breasts, there's no genitals. It literally is just, what is the sensation of touching my partner like? And what is the sensation of being touched like? You can do stuff with the environment, sound, music, make a whole thing of it.
With the explicit rule being like, you're not going to have sex. So you're not worrying about where it's going or what it's leading towards.
It is just about the sensual experience. Week 2 is adding in breasts and genitals, but not in a necessarily sexual context. You're still not trying to get off, but it's just like, okay, now we're exploring all of the body. Week 3, then you can add in a little bit more like mutual touching, maybe some kissing, but you're still not having full on penetrative sex. And then week 4 is full sex again. And it's supposed to be slow to help reduce shame, to help get you in the mindset away from just PIV sex as pleasurable as intimate.
And to be honest, when I have talked clients through this, I've added like a week 1 of just like laying together, looking at each other, talking.
I love that.
Maybe I am a sex therapist.
Kind of are. Also, our practices specifically, I imagine that's more common than perhaps other practices.
Yeah, probably so.
Okay, so we have like arousal disorders. We also have orgasm disorders. So delayed ejaculation, female orgasmic disorder, and premature ejaculation. Delayed ejaculation is when it is very difficult for people to reach orgasm. Specifically, often it's men, because female orgasmic disorder is the delay or absence or marked intensity of orgasms in women. 10% of women report anorgasmia, which is never experiencing an orgasm. And there's 2 types. There's primary anorgasmia, which is you've never been able to achieve an orgasm. And then secondary anorgasmia, which is at one point you were, and somehow along the way it feels like that ability has been lost. Fun note, premature ejaculation is an orgasm lasting less than 1 minute of sexual intercourse. Anything longer than a minute, technically not premature ejaculation, according to the DSM.
Interesting.
So, men, if you're out there, longer than a minute, you're good to go, buddy.
And also, like, if it goes longer than like 30 minutes, let's just wrap this up.
The way to treat premature ejaculation, they use different words in this, but the official treatment for it is just edging.
Oh.
I think they call it the stop and squeeze method, but like literally it's like bring yourself to the edge of orgasm and then stop and let your body learn to like build up a tolerance for it, which I just think is very funny. I enjoy my role as a sex therapist giving sex homework because it's like, yeah, your homework today is go put a butt plug in or whatever. You're a therapist prescribed butt plug. Here's your prescription.
I do less of that with my grief clients.
Although, maybe not none.
Do I have an intervention for you?
Have we got a show for you? 2 VeggieTales references.
Can you imagine? All right, I hear what you're saying, and here's my idea.
And then there's sexual pain disorders. Interestingly as well, these are only focused on women or female presenting people, AFAB people. And the only diagnosable thing is called genitopelvic pain / penetration disorder. This is an update to the DSM-5. It combines 2 previously separate diagnoses, dyspareunia and vaginismus. Now it's all just under one label. Basically, this is pain during vaginal penetration. It may also include fear of penetration or tightening of the pelvic floor. So there's a number for any number of these things, any of these diagnoses. There are often multifaceted reasons for them. When we're assessing people for anything in therapy, we're looking at what's going on biologically, psychologically, and socially. It's known as a biopsychosocial method because no one in psychology is creative or good at branding, except for Erik Erikson, but that's kind of his parents. And so with genitopelvic pain or penetration disorder, often it's the cyclical thing. There's initially pain for whatever reason, and then understandably, people get anxious. I don't want to feel pain when I'm having sex because it's hurtful, because it stops the intimacy with my partner. But then that fear itself causes them to tighten up and not relax, which then increases pain. The last subsection of diagnoses is just other. So there's medication or substance-induced sexual dysfunction, or other, this is the best one, other and unspecified sexual dysfunction.
I know. I love the DSM so much. There's so many places where it's like, just other stuff.
Yeah, unspecified. It's like close to this.
What are the V codes or something?
Oh my God. Z codes, V codes, F codes.
It's like something's going on.
Let's talk about CPT codes for half an hour. If this means nothing to you, congratulations.
Congratulations, you're not in debt.
Oh, Joe Biden, help me. If you're experiencing any of these things, any of the symptoms related to things we've talked about, please go talk to your doctor. A full assessment should include biological, psychological, social information, medication and diet, relational dynamics, personal history, whatever. But shame and performance anxiety are often, although by no means always, a significant factor in sexual dysfunction. And that's really a lot of my work as a sex therapist. Just being able to talk about sex itself can be a huge barrier for people to be able to say, here's what's going wrong with me, here's what's going on with me. And then performance anxiety, a lot of people are really worried that they're bad at sex. And being worried about being bad at sex makes you bad at sex. It's a self-fulfilling prophecy. Mm-hmm. So a lot of the work is just developing confidence. I see this, I work with a number of men who have HIV, and there's a lot of shame and stigma around that, and just being able to communicate that to a partner. That has been transformative for people. Nothing else changes other than the ability to say, hey, you should know I'm HIV positive.
Yeah. Also, there's no rubric for sex. It's like bad at sex and good at sex is so subjective. Mm-hmm. Like, don't worry about it.
It depends on your personal meaning of it.
Yeah. And also, like, it's more just like chemistry. Like, either you connect or you don't. Like, it's not about if you're good at it or not.
So we're still in the official, like, DSM world. But you know what's not listed? Sex addiction.
Oh, yeah.
Porn addiction.
Do you want to know what? That's because I was told in the human sexuality class that that's not real and doesn't exist.
Exactly. I get why people call it this. Because there is absolutely, some people experience a version of compulsive sexual behavior, or they feel like they're out of control, or partners will be like, you're just, you feel like you're addicted. In common parlance, I don't really care if that's what you call it. Sure, fine, whatever. But clinically, as a clinician, and especially as an ex-evangelical who's recovering from this culture, I care a lot about the words that we use. Oh my God, has purity culture made a killing off of treatment of quote-unquote porn addiction. I went through a program by a company called X3 Church, go fuck yourself X3 Church, meant to help curb my porn addiction. I went through this program twice because it did not work, and it also did not work the second time. I paid way too much money for it. It did, however, increase my self-harm at the time. To be clear, I wanted this. I wanted to go through these programs. I sought this out. No one forced me into it. No one said you have to do this or else you're going to lose your status or you're going to be punished, you're going to throw out. Like, this was a thing that I wanted to do because I was so wrapped up in this purity culture. I felt so much shame around having any sort of sexual thoughts. And also, again, because I was gay. That was just an additional layer of shame on top of all of this. I was so deeply wrapped in like internalized homophobia that when I first started looking at gay porn, I couldn't type gay porn. I typed in porn for women because I thought somehow that was better. The compromises we make with ourselves. But this is also where we get this program called Covenant Eyes that we talked about.
Oh, yeah.
Speaker of the House, Mike Johnson, uses Covenant Eyes with his son, which is always an insane sentence to me.
It's so weird.
And that's a subscription model. You pay for this. People are making money off of people's shame. And all these things they do not reduce the amount of porn that you look at. They do not reduce sexual urges or thoughts. They just trap you in cycles of shame. That's not treatment. That's destructive. Again, this is not to say that people don't struggle with sexuality in serious ways, but treating it as an addiction is, at best, only marginally helpful, and at worst, actively harmful. A brief history of the field. Psychology is fucked. Let's start there.
Thanks, Freud.
Yeah, thanks, Freud. Oh my God. We, meaning psychology, which often means like rich white people in academia, didn't have a good understanding of sexuality, basically ever. Masturbation used to be seen as a sign of mental illness, despite everyone doing it and being fine. Non-reproductive sex, homosexuality, BDSM, and more have all been pathologized in psychology. The original version of the DSM, you could be diagnosed with homosexuality.
Yep.
Sorry, I can't come into work today. I'm gay.
Yep. And honestly, on a serious note, that wasn't very long ago.
No.
This whole field is so young. And a lot of people are scared to come to therapy because of that, right? And so a lot of therapists have to identify, even if you don't work somewhere like we do, which is like a very LGBT focused practice, like people have to identify as like LGBT like trained therapists, right? So it's like, I will not hurt you. I will not judge you. I will not use the old DSM model on you.
Absolutely.
Yeah.
The version of the DSM that no longer included homosexuality as a diagnosis came out less than 50 years ago. 41 years ago, if I'm doing my math correct, which is insane. That's also the reason why James Dobson is no longer a practicing clinician or on the board of the American Psychological Association.
Oh, yeah. When you said 41 years ago, in my brain I was like, yep, in the 50s.
Because it's 1994?
I don't know. I think that's where my brain lives. And then I was like, no, girl.
It's incredible.
I have some bad news.
So sex addiction as a term entered the field in 1983. But there's no consensus on what counts as an addiction and under this model. So if you watch porn every day, is that an addiction? If you masturbate 5 times a day, is that an addiction? For any given purposes, these may or may not be problematic, but the behavior by itself has no inherent meaning. There are people who masturbate 5 times a day, totally fine, live happy, healthy, normal lives, and otherwise, there are people who masturbate once a week and then feel so drenched in shame, they feel like they've hurt God's feelings, and that's more destructive to them, right? It's more, again, like the theme of the whole episode, it's about the meaning that you make of it.
Yeah, and it's about, I would say, for any of these things that like addiction, it's about the distress it causes in your life, right? And so it's like, if you masturbate 5 times a day and that feels great and you're happy, great. If you do that and it's causing you a great amount of distress or you're skipping work to do it or whatever, like, then you go talk to someone. But yeah, it's not inherently all just a problem or an addiction.
Absolutely. There's a quote from a treatment model that we're going to talk a little bit more about in a second, but it's about this. So, quote, the addiction model may limit our understanding by offering an oversimplistic view of the diverse issues encountered by this clinical population, people who are struggling with sexuality. There's little systematic research dealing directly with sex as an addiction, and the epidemiology and treatment literature is primarily anecdotal in nature. So what that's saying is there's no research backing up the fact that it's an addiction, and by treating it as an addiction, we're oversimplifying the causes of it. The American Association of Sexuality Educators, Counselors, and Therapists, called ASECT, they're kind of the leading body around sex therapy in the United States. They put out a statement about it. Quote, ASECT recognizes that people may experience significant physical, psychological, spiritual, and sexual health consequences related to their sexual urges, thoughts, or behaviors. ASECT recommends that its members utilize models that do not unduly pathologize consensual sexual behaviors. ASECT 1 does not find sufficient empirical evidence to support the classification of sex addiction or porn addiction as a mental health disorder, and 2 does not find the sexual addiction training and treatment methods and educational pedagogies to be adequately informed by an accurate understanding of human sexuality. Therefore, it is the position of ASECT that linking problems related to sexual urges, thoughts, and behaviors to a porn sexual addiction process cannot be advanced by ASECT as a standard of practice for sexuality educators, delivery, counseling, or therapy. Instead, ASECT advocates for a collaborative movement to establish standards of care supported by science, public health consensus, and the rigorous protection of sexual rights for consumers, seeking treatment for behaviors related to consensual sexual urges, thoughts, and behaviors. So the addiction model, not good, out the window, but instead, what do we use instead? If it's not addiction, fair, but people do truly struggle with problems of sexuality. Currently, the best practices in the field is a model called out-of-control sexual behavior. This label reflects the felt experience that one's sexuality is out of control, not that it actually is out of control. And it focuses treatment on helping people understand the roots of the perceived dysfunction and motivations behind sexual behaviors, and uses this wisdom to improve their sexual health. It's really hard to talk in generalities about this because it takes into account a lot of nuanced contextual factors, which is what a good treatment model does, and not what porn addiction as a model does. I have another book for us.
Oh, here it comes.
Treating Out of Control Sexual Behaviors, Rethinking Sex Addiction.
Oh, that looks like a good book.
It is a good book. It is, if you're a therapist, you should read it. If you're not a therapist, do not read it.
Oh my God. If you're not a therapist, don't ever read any books for therapists. They're not insightful. They are dry. That's the first time you've ever pulled a book I would want to read out of your bag, and I'd like to thank you for that.
Absolutely. See, it's a better episode. It's not as traumatizing this time. I pulled some quotes from this book. I've used them already throughout this book, or this book.
Blog.
Yes, I pulled quotes from this book for this blog already. So there's a good treatment model. It's not addiction. Often I find that when people are viewing it through the lens of addiction, the main thing is just working through shame. Mm-hmm. The problem isn't that you're watching porn 5 times a day or whatever. The problem is that you experience shame about it. There's actually really interesting clinical research that the same behaviors lead to different results based on your interpretation of it. So really, like, they've done clinical studies that say if you have shame around sexuality and then you engage in what you perceive to be shameful sexual behaviors, you're going to see dysfunction. You're going to see mental distress. But if you don't have that, you're not going to see any of those things. So it's actually not about the behaviors. I meant to talk about this in our first episode about purity culture, but a lot of the sex addiction model is just sexual repression, and it makes everything so horny. There's a book called Every Young Man's Battle that I read growing up that's like every young man's going to be tempted by ladies, which, again, no. But they tell their testimony, they give their testimony, like, how did I get to be so wrapped up in sexuality? And their stories just read like softcore porn. Like, I remember being in my grandfather's garage and seeing pictures of naked ladies and feeling weird and tingly. And then it was my best friend's older brother who brought me up to the treehouse. And one day he pulled out, it's just like, that's just porn. And I know because I used to masturbate to it while reading it. Very confusing. So I find often Sex Addicts Anonymous gives a similar vibe of just sexual repression, and then everything is so sexually charged. When you're able to make peace with your sexuality and all the ways that it manifests, then often you're also able to have a better control over it. Once I've been able to accept my sexuality and like find a rhythm and a flow for pornography and masturbation and partnered sex that works for me, I go days without thinking about it. I have like so much time in my life that it's not just centered around sex and sexuality. When you're able to chill the fuck out, it makes a big difference.
We're going to get hate mail about this one, I can tell.
Go for it.
Especially when I say the following thing, which is so off topic, we don't have to talk about it all, but like, probably I feel this way about Overeaters Anonymous.
Ooh, interesting.
When we have a different blog someday, we can talk about that.
Let's talk about porn itself for a second. Because porn is defined as, the Webster's Dictionary defines porn as, media displaying explicit sexuality intended to stimulate erotic feelings. Pornography is not inherently harmful. But porn as it exists in today's society, there's a lot of fucked up shit that goes into it. And I think it's important to have this nuance. People have been making porn since forever. And the same is true of sex work. It isn't inherently evil. Evangelicals will say that porn is degenerative and that's why it's wrong. Radical feminists say that it's rape. They're both wrong, although evangelicals are more wrong. The general feminist point is that if a woman, and they do tend to focus on the experience of women, consents, even if she consents, she's being exploited. Because it's either this or starve, like this kind of coercive nature of sex work. Which I think is a fair point. But that's just a critique of capitalism. I've worked quite a few jobs in my life, including some in gay sexual spaces, but the most exploited I've ever felt was working for Target in my undergrad. There are days when I would just be stuck in the walk-in freezer for like hours on end, and I would cry, and the tears would freeze to my face.
Oh my God.
Yeah. So yes, it is coercive, but only, at least generally, only in the sense that all capitalism makes all work coercive. There is no ethical consumption under capitalism.
That's such a good point. That really is. Like, it is. Like, I have not been a sex worker, but I can imagine situations where that would not feel exploitative. as opposed to other work situations, like the one I told you about earlier, washing coffee cups in a men's bathroom, where it did, right? And then, yeah, it's, that's interesting. I'm going to think about that.
And it can be exploitative. There are absolutely problems in porn and sex work and all these things, but there are some unique things to the field of sex work because it does involve sex and bodily autonomy. But also in some ways, it's just a fucking job. And all of the critiques of porn and sex work tend to also be critiques of capitalism, I find. Also, much like evangelicals, I've had some radical feminists be stumped when I ask them about gay porn, because if they're all focused on the exploitation of women, which is a real problem, like, is gay porn as exploitative? And it also can be, for sure, but like, let's be precise in our critiques and language.
Mm-hmm. For me, it's just sort of like, know your porn. Like, know where you're getting it from, know that the people were all consenting and that it was safe and all this stuff, right? It's like, then go to town.
That is exactly what we're going to talk about next.
Okay, good.
Literally, the next bullet is porn and harm reduction.
There we go.
So porn studios are varying degrees of bad. There's issues like STD testing. It is impossible to be 100% safe with any kind of sexual encounters. This is technically the point that Dobson makes. It's a yes, but you're also wrong for everything else. So instead of saying safe sex, in the field, we'd like to say safer sex. There are things that you can do like condoms, dental dams, PrEP, which is a pre-exposure prophylaxis, which is a thing you can take for HIV, doxypep, which you take afterwards to reduce the likelihood of other STIs, whatever. But in porn specifically, it's difficult because there is often a window period, an incubation period. You can be infected with any kind of sexually transmitted infection. It can be in your body and you can spread it to somebody before you can test positive for it. Typically, I recommend my clients wait about 3 weeks between some kind of sexual encounter and getting tested, just to make sure that if they are actually positive for something, it's not a false negative. But porn often doesn't have 3 weeks. There's not that turnaround time. So you're going to have more of a risk in porn. Informed consent can be important. If you know about this, there are treatments, there are ways to minimize that risk, like we said with doxypep or PrEP or whatever. If you're making that informed decision for yourself, great, go for it. That is not always the case. And in porn, the porn industry, often the talking point is like, we're the most tested people, which is true technically, but again, it's this flawed argument. It's not 100% effective or safe. They say that often without acknowledging the risk. Abuse and consent. Some producers and studios do lie and trick actors into participating. Lying or lying by omission about what's involved in the scene, lying about who's going to see it, ignoring safe words. Some porn is legitimately just filmed rape. And that is a reality that we need to contend with. Again, we need to be precise in our critiques, and that is a real thing. And misogyny. A lot of porn does just reproduce harmful misogynistic tropes. Treating women as objects, violence against women with dubious consent, etc. These are real problems, for sure. But often, most of the blame and shame is directed towards the women in pornography. Male fans especially can be cruel. Like, doxing is a real thing for especially porn actors who are women.
Really?
Oh, huge.
Oh, I didn't know that.
It's like a fucking industry.
Oof.
There are, again, like rape culture incel types who like will just dedicate parts of their life to finding the real names and addresses of people who appear in pornographic films and then send them their own clips and family members' own clips. Like, this is real things that happen. There are absolutely problems with this. But when you just say all porn is bad or all sex work is bad, you're going to get people who rightfully say, no, it's not, because I feel empowered, because I'm able to survive, because I do it for myself. And then the people who actually are harmed in it get lost in that shuffle. There's good things about it. There are ways to do it well or from a harm reduction lens. And when we're able to do that, we're also able to really more meaningfully critique the things that suck about it. So from a harm reduction lens, some studios are better than others. Like you were saying, know where you get your porn. I am not going to endorse any specific studios here because none are perfect. And also that would reveal way too much for the porn that I watch. But I encourage you to do research on the porn that you're watching and see if it aligns with your values. Again, this whole conversation is rooted in what are your sexual values. If you care about it being consensual and non-exploitative, what does that mean for your porn? That's a conversation you need to have with yourself. Also, independent porn, things like OnlyFans, just for fans, it can still be problematic, sure, but often in much less intense ways because people really get to have a lot more agency over what they do, who they do it with, how it gets distributed. I've had quite a few friends who have OnlyFans, and they love it. They get a sexual kick out of the exhibitionism. They can make some money on the side. They can feel desirable. So while we're acknowledging the bad, we also must acknowledge that there is good, because it is nuanced. That's kind of the point of all of this. We're trying to be nuanced and thoughtful and comprehensive in our understanding and our discussion.
Mm-hmm.
Also, a side note, sex work is work, and fuck capitalism.
Yes.
There are, even without capitalism, there would be problems in these fields for sure. But often, and we see this with Dobson as well, often people are trying to critique capitalism, but for whatever reason don't do that. And so just focus on one thing and make a bad argument because of it. They're not able to see this bigger picture, or willfully unable to see this bigger picture. Okay, section 3, the last section, policy recommendations. Let's talk about, so we have this idea, we have the sex positive view, we're able to talk about sexual dysfunction and relationship stuff in meaningful ways. Now what do we do about it? First, kind of continuing our last conversation, decriminalize sex work.
Yeah.
It makes it safer for the sex workers as they can seek help without fear of arrest. Right now, in the United States, where we both live, if you are a sex worker and you are assaulted, kind of don't have any recourse. Mm. If you are particularly lucky or have ins in relationships, you might be able to go to the cops. But also then the cops might also then assault you. And so decriminalizing sex work makes it so that people who are suffering or in there under coercion or other illegitimate reasons can go get the help that they need. The Nordic model, which is criminalizing being a John but not a sex worker, so criminalize paying for sex but not doing sex, is also a failure because it increases the stakes for people. So then if a John is already prone to violence and then they feel like they're going to get outed, they become even more violent. And full legalization means that government and cops getting involved, and there can be regulation of it, and that's also bad because fuck the government.
Yeah.
And obviously, criminalization of it doesn't work.
Right.
Really, the best model is decriminalization. There's also issues with that as well, but to me, that is the most harm reductive model. But this is my favorite topic. Let's talk about comprehensive sex education.
Okay.
And this, I think, is really the main policy recommendation, because the way to have these conversations, the way to actually address these things for people in a meaningful way and to create systemic change is to give people the information that they need. So this information, full disclosure, I did not come up with it myself. I am not that smart or that responsible. This is from the National Sex Education Standards, 2nd edition, by an organization called the Future of Sex Education. This is endorsed by the American School Health Association, the Center for Human Sexuality Studies at Widener University, the Human Rights Campaign, the National Coalition of STD Directors, and more. So this is kind of the one of the main forefronts around what comprehensive sex ed could look like. And so the main thing is that it's age appropriate. And there are ways to teach these concepts in age appropriate ways, but what a lot of people think about as age appropriate actually isn't. They try to infantilize and protect kids, quote unquote protect kids from being sexualized when they're already doing those things. So ages 0 through 5, just teach kids about their bodies. This is your foot. This is your knee. This is your penis. This is your nose. Just give them the anatomically correct words. A kid doesn't know to be embarrassed by you saying the word vagina or labia. They only know that it's a bad word or whatever if you feel squeamish or if you call it their hoo-ha or whatever. Mm-hmm. Which there are some people who I see in therapy who really struggle to use the correct anatomical words because of the shame that comes with them. So just using the correct words, that also, as we talked about in other episodes, gives people the ability to say, something happened to me and let me tell you what happened.
Right. Although it is okay when you're just hanging out drinking wine with your friends to call it your hoonie.
Yeah. It's fine to call it whatever you want, but you should also be able to say the words.
Yeah, and kids should be taught the words. And not that this is what this is about again, but there are so many parallels. You can also let your kids say the word fat.
Yes.
And other words like that, because where they learn to be ashamed of that is when you yell at them for saying it. Mm-hmm. Right? And so I have friends who have kids that will say, you have a big butt or you're fat. And my friend and I will be like, yeah, you're right. And then the parents will say, you're right. And also, let's just not talk about people's bodies.
Yeah.
Right?
Yeah.
I love that, gentle redirection, right? And they do it when the kids talk about other people's bodies, too. Mm-hmm. Right? So it's helpful. But please let your kids say fat and don't punish them.
0 to 5, just teaching kids about their bodies, letting them socialize with other people as like you would with kids. We really get into the policy recommendations here around kindergarten. So for like ages 6 to 8, kindergarten through 2nd grade. A big part of this is also social and emotional learning, because like we've been talking about, sex isn't just about the physical acts of sex and the body parts involved. It's about the relationships. So to be able to say what makes a good relationship is taught throughout all of this as well. That's a really important part of comprehensive sex ed. Kindergarten through 2nd grade, ages 6 to 8. The first thing that this recommendation is teach them what it means to be a good friend. Right?
I love that.
You can also teach them personal autonomy and boundaries, consent. Do you want to hug a grandma? Make it a question as opposed to a direction. It's a choice that they can make for themselves with their bodies. Also respect the boundaries of others. Hey, let's not touch other people's bodies without, like, if they don't want it to, right? Like you were saying, there's a way to like gently redirect that.
Mm-hmm.
And also know that people should not be touching their genitals, the difference between good and bad touch. That is age appropriate, absolutely. They should also know about different family types, right? Okay, you can have just one mom. You can have 2 dads. You can have a grandma living at home. You can be adopted. Just like these are just different types of families out in the world. And they should know that this early because some of them already have those families.
Right.
Some of their classmates have those families.
Most of them.
It's not exposing them to anything that they're not already exposed to.
Mm-hmm.
Know ways for friends to express their feelings, physically and verbally. And not just romantic feelings. Like, okay, if you're angry, it's not okay to punch someone in the face, but it's okay to be like, ball up your fist and be real angry. That's okay. That's a way to express it. Or you cannot say a bad word when you're angry when you're that young. But like, you can say, like, I am so angry right now and I need to go scream. Right? Like, they're again, how to do it safely. Also, introduction to gender and gender stereotypes that can be limiting. You don't have to give them Judith Butler's gender trouble book, but you can be like, boys are allowed to cry, girls can be president, whatever. Like, they're, again, I'm using these like big academic terms, but there was ways to make it that a 6-year-old can understand. And also just a general overview of reproduction. Not the full birds and the bees, but like, mom can be pregnant and that's how you get a baby brother.
Mm-hmm.
The idea is that life reproduces and humans reproduce. Fine. 3rd through 5th grade is the next block that they chunk out. This is ages 8 to 11. And this is where I think people really start pushing back. First, introduction to puberty. Mm-hmm. Its biological purposes, also what to expect, including planning for personal hygiene. You're going to start sweating. You're going to get hair in these places. And here's what you do about that. It's normal. It's okay. And also, let's make sure that you're taken care of. Know who is safe to talk and ask questions to. Not every adult you should ask questions to, but some you should be able to. Teachers, parents, God forbid, people at your church can also be decent enough, like, people to ask. Mm-hmm. Acknowledge that bodies come in a variety of different experiences. Size, but also ability, but also, like, people go through puberty at different times, at different rates.
Right. Especially at that age.
At age 11, at the end of 5th grade, some people are already, like, in the throes of puberty.
And some people look like tiny children still.
Yeah. And some people don't go through puberty for a while still, but it's an experience that people are having and the people around them are having. They deserve to know about it. Mm-hmm. The differences between sex and gender can be important here. And this is where I think we're going to, not we, but people are going to get pushback, and also what sexual orientation is. But it's important that kids learn that at this age because that's when they're discovering what that is. They might already have trans classmates. And again, you don't have to give them the full dissertation, but be like, oh yeah, that's Jane, was born a boy, but Jane's really a girl.
And it's not as complicated as adults think it's going to be.
No.
Talking to kids about this. I'm sure you've seen that TikTok, right? Kids also want to talk about anything for about 1 minute.
Yes.
Right? And that TikTok where that kid's like, are you a man? And the person's like, no. And they're like, are you a woman? And they're like, no. And the kid just goes, are you just like a person? And the person goes, yeah. And the kid's like, all right, see ya. Like, they're not going so deep with this as the adults are. Mm-hmm. They're really willing to just sort of say like, okay.
I don't even know how to call him YouTuber. That feels dismissive. The YouTuber Hank Green recently released a comedy special about his cancer diagnosis. And he has a moment in where he's talking about like, I have to tell my son now that I have cancer, and like, I don't know how it's going to feel. And so we like talk about like, Dad's going to like be in the hospital and is really sick. And the kid goes, Dad, did you know that if you put a magnet to a piece of metal, that piece of metal also becomes a magnet?
Can I tell you something? I was talking to my nephew one time when he must have been like 9, and whatever, we were going through the whole thing. And I said to him, and I go, I just want you to know that if you ever have any questions for Aunt B, that's what they call me, that you can ask me. And he said, okay. And I said, do you have any questions you want to know about? And he said, yeah, I do. I have one that I've always wanted to know. And I said, okay. And he said, how can electric eels glow underwater when there's no electricity?
That is a good question. That kid's going places.
I know. I thought it was so cute. And also I was like, I don't know.
Yeah.
Ask about our family.
I know a lot about trauma.
I know. Yeah. Anyway, yeah, I think it's so real. Like, we are the ones who make that complicated.
Absolutely.
Mm-hmm.
I've mentioned a younger brother. He's significantly younger than I am.
Mm-hmm. Tyler.
Kevin and Tyler, yes. My parents, Brad and Janet. And my coming out was a fucking ordeal. There was crying, there was screaming, there was me being thrown out of the church, whatever. My younger brother never had a fucking issue with it because he was young enough. I was like, hey, I'm gay. Okay.
Mm-hmm.
Whatever. They didn't care. We had to stop him from going around introducing me as his gay brother, though, because he just thought it was just a fun fact about me. It's like, I'm glad you don't have shame. I used to say there are more interesting things about me. Yeah. Which isn't true, but...
I told my nephews that Aunt B puts the B in LGBT.
Okay, so more about 3rd through 5th grade, ages 8 to 11. Overview of pregnancy and also STIs. Mm-hmm. A little bit more about the anatomy and the function and that these things just exist. You don't have to get into all of the details, but especially just like HIV. You don't have to get into the details, but like they might have a parent living with HIV, mm-hmm. or some of them might have HIV themselves because it's possible to have HIV at any age. And mm-hmm. so just these are things that exist in the world. Also, to be able to find sexual harassment and violence. Mm. This is when it gets really uncomfortable because, again, people want to protect 10-year-olds from sex. But sexuality exists throughout their lifetime. They are sexual creatures even at 10. And some 10-year-olds are already starting puberty. They're already been victims of sexual harassment or violence. Again, if this is an experience that they have, they deserve to have the language to describe it and know what's happening to them as much as they can at that age.
That's right. And not reinforcement of shame.
Absolutely. Mm-hmm. Grades 6 to 8, ages roughly 11 to 14. At this age, kids are really able to like see the world in a lot more of a nuanced, full way. There's still a lot of like egocentrism that's still like through their own lens, but it's beginning to broaden out. And so to be able to compare and contrast characteristics of healthy and unhealthy relationships, mm-hmm. not just romantic relationships, although also that, because like we were saying in the last episode, that's around when people might start dating or trying out relationships or having their first kiss or whatever. So what makes a healthy versus an unhealthy relationship really important? Knowing the impact of technology and social media on relationships. I think Facebook says you have to be 13 to sign up, which one, a lot of kids under the age of 13 get on Facebook and social media. But to know that people post lots of happy pictures online and that's not always true of their reality. Right. Or you shouldn't post the pictures of naked people, even if they send it to you consensually, which is a whole separate thing, but like respect people's privacy, delete them when you're no longer in a relationship with them, that kind of thing. Mm-hmm. Know the differences between friendships and romantic relationships and sexual relationships. Be able to teach sexual consent and agency, so revisiting that consent piece and really talking about what that means as a sexual being. Also, age of consent and why that's important, because you might be horny and exploring your sexuality is totally normal at that age, but an adult should not do that with you because right. you can't consent to that.
I would say even teaching at this point, like about grooming.
Yes.
Right? And like that is not love. You are not special, right? That is a specific thing that's happening.
Absolutely. An in-depth understanding of human reproductive systems, as well as variations, such as like being intersex, or even just like circumcision. Penises can look a lot of different ways. Labias can look a lot of different ways. To be able to define gender identities and sexual orientations, even those that aren't impacting you or the people in your immediate vicinity. Mm-hmm. To be able to define vaginal, oral, and anal sex, because kids are already doing some of those things.
Yeah.
In middle school, I knew people that were sucking dick in the back of the school bus.
Yeah.
You deserve to know what that is. And also, when you give people education, when they're allowed to make informed decisions about their bodies, that actually can delay the onset of sexual intercourse.
Yeah. Also, everything I learned about sex when I was 13, I was learning from other 13-year-olds.
Yes.
Right? And let's not do that. Right? Like, let's learn from adults who can have these conversations and where you can feel really safe to ask questions. It doesn't mean that kids are going to run off and do it. It really doesn't.
Yeah.
In fact, it's probably more likely that they won't.
Yes.
Right?
And going back to sexual values, you can teach your kids your sexual values.
Right.
And say, as long as you're in my house, you're going to follow these rules. That's a little bit authoritarian parenting, but also there's like, you got to create safety and boundaries for your kids. That is okay. But also encouraging them as they get older to start developing their own sense of values and morals around sexuality, even and especially if they differ from yours. And they're allowed to be wrong. They're allowed to make mistakes because they're fucking 16 or whatever. They're going to be stupid as shit. That's developmentally appropriate. You should also, at this age, if you were going to, since we're already accepting the possibility that they might be having some kind of sexual intercourse with other people, they should then know more about STIs and pregnancy, as well as prevention and testing, symptoms, knowledge of condoms, dental dams, and then also local laws around sexuality. Be like, okay, in some states, age of consent is like a hard line. So if you're 18 and you're having sex with your partner who's 17, technically that's illegal. If you are sending nudes to a partner and you're underage, but they're also underage, then you're both technically committing child pornography, distribution of child pornography. Know about that. So you can make informed decisions about your body and not go to fucking jail at 17.
Right.
And then when we get into high school, 9th through 12th grade, 14 to 18, like this is when we're just like really the same topics, but a lot more in depth. What is condom? How do you put a condom on? When I was in undergrad, I was booked for a drag show to teach the incoming class of freshmen basically sex ed 101, because we had people coming from all around the country, and people from Texas might not have the same sex ed as people from Maryland or Iowa or California or whatever.
Right.
I had the whole crowd at one point chanting lube, 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 lube. That's an important thing for people to know about, because we talked about like pain and having sex. Sometimes, although ideally vaginas can be self-lubricating, sometimes they need a little bit extra help. If you were having anal sex, oh my God, do you need lubrication for that? Right? And again, people are doing these things. They deserve to have the information to make informed decisions about their body.
And like, your child is also doing this.
Yes.
Even if you think they aren't. And you know what? Maybe they aren't. But maybe they are.
Maybe they are.
So you might as well be ready. And I would say at these ages in high school, especially like upper high school, be ready to have a conversation with your kid who might come to you and say, I'm thinking about having sex, or I did have sex, right? And how you want to sort of manage that and have those conversations.
If your kid tells you that, that's incredible.
Yeah, it is.
That is a testament to the relationship that you have built for them. And it's also really important that your response honors that relationship.
Yeah. It's so fascinating, just kind of keeping in the theme of our podcast, that like these feel so healthy and so appropriate. And then when you sort of like put them side by side with purity culture that we've been talking about, what a mess. Right? Like you, in the last episode, you talking about like being 15 or 14 and thinking like, well, I got to think about marriage. You know, it's like so off base from this model that's so appropriate.
By restricting people's access to this knowledge and the ability to talk about it meaningfully with you or other safe people, they're going to do it. They're going to talk about it. You're not giving them permission by giving them sex ed. You're helping them make informed decisions.
Right.
In the last bit on our policy recommendations, we talked about comprehensive sex ed. We've talked about decriminalizing sex work. To me, the foundation of my understanding of sexuality and how I do sex therapy, masturbate. I encourage you to masturbate and enjoy it. Make a whole night of it. There are so many people that I talk to that masturbate like out of pure functionality. Like, okay, I need some stress, or it's just like a good way for me to go to bed. And that can be fine. But also you're allowed to enjoy it. You're allowed to bask in it. You're allowed to, I don't know, whatever turns you on. Be gross. Look at porn. Read erotica. Just fantasize in your brain.
Or do that thing we talked about earlier about being sensual with your own body, right? Explore your own body. Find out where things are, what you like.
Absolutely. You're allowed to be wrong even with yourself. I wonder what will happen if I do this. Oh, no, I don't want that. Oh, wow, I really, really do like that. Huh. That's okay. We're coming to the end of this episode, and also apparently the end of our time here because the lights have gone out again.
The lights have gone out.
Apparently,
garbage has been collected.
11:30, that's the cutoff.
Oh, God.
I don't have a pre-written ending for this because I really just wanted to the whole thing about this is being real and honest and nuanced and personal. So I wanted it to be personal. Sex is a really important part of life. even if you are asexual, even if you experience no sexual attraction, even and especially if you experience trauma, it is a part of life. It is a part of our culture. It is a part of humanity, and that's okay. But it's also only a part. Mm-hmm. People who try to make it their entire world or their entire religious belief, even if it's don't do it, they're still making it all about that. Again, when you're able to chill the fuck out and appreciate it for what it is, you're also able to have a life outside of that in a lot more meaningful, relaxed way. Mm-hmm. I want you to take control of your agency, your sexuality, to be able to celebrate it. If you are having troubles, physiologically, mentally, psychologically, we didn't talk about paraphilias necessarily, but if you have a sexual attraction or sexual desire that you find is problematic, talk to a therapist. There are people specifically trained in working with that who are able to help you be in this place that's like in between shame and functionality. Mm-hmm. You're able to work through it and live a happy, healthy, productive life still. It's okay. And importantly, just talk to people. Mm-hmm. Talk to people who are safe. Talk to people who you know and trust. But you don't have to do any of this alone. Unless you want to do it alone. And that's okay. Brooke, how are you?
I'm great. I really appreciate the idea of nuance because I feel like that is the main thing missing in all of these books that we've been talking about, right? Mm-hmm. It's not so black and white. It's not so simple. And trying to really simplify all of this into like, this is purity culture or this is bringing up boys or girls or whatever, right? Mm-hmm. And we're here saying like, no, it's a lot more complicated or beautiful or nuanced than all of that, right?
Yeah. Mm-hmm. I keep saying it's about the meanings that you make of it. And to really understand that, you have to know yourself pretty well. You have to be able to understand, is this relationship working for me? Is this actually a value that I have? It requires a lot of like self-reflection and self-knowledge, which is super empowering, but that's a lot of work. And you have to put in the work to be able to get to a place where you can appreciate that nuance, that context. Mm-hmm. I'm really proud of the work that we've done here today and in the series. Brooke, thank you for being with me throughout the slog of purity culture and the bright end of this.
Jake, thank you. I'm very proud of you. You're the one actually reading these books, and even though you say we read them, I do not ever read them.
I feel like you get the experience.
And I'm proud of you. I think this has been really helpful. It's been helpful for me. I've learned a lot. I've gotten to say things like purity balls and holy bones.
Holy bone. God bless.
Oh, I like that you sang it. Let's sing it together.
Holy bone. Beautiful. Listeners, take care of yourselves. And as always, I fucking hate James Dobson.
I hate James Dobson, but I love myself.
Good. I love you too.
You too.
I Hate James Dobson is Labor of Love, written, recorded, edited, and produced by me, Jake. I'm honored to be joined by my amazing co-host, Brooke. If you're enjoying the show, please consider rating and reviewing it, and if you want to connect with us more, you can find us on TikTok, Instagram, and YouTube at I Hate James Dobson, and on Twitter at I Hate J Dobbs. If you want to email us, you can do so at ihatejamesdobson@gmail.com. Special thanks to Drew, Lindsay, DJ, and Jack. Our theme music is by Mood Maze, and the song is called Trendsetter. Thank you for enjoying our show. Welcome to I Hate James Dobson, a podcast dedicated to Jocelyn Elders.
Oh, yeah.
Love her.